Welcome to my Breakthrough Knee Pain Recovery Program. You can find out more at michigankneesolutions.com and kneepaintrigenics.com. If you've been told that you have osteoarthritis of the knee and have knee pain, and also have been told that you need arthroscopic surgery or perhaps even a knee replacement surgery, and you're looking for an alternative solution, you've just found it. Here we have lumbar decompression using the DTS non-surgical spinal decompression table for dealing with the neurokinetic chain down in the lower back of the nerves that go down to the knee. Okay, now we're using the knee on track with the MR4 laser on the knee here. This again helps with tissue healing, and the traction actually helps with getting hydration back into the cartilage. So it gives it a chance to regenerate. Back in 1987, Tapio Vitamin showed us how cartilage could regenerate. He was the first person, and that's the subject of another video. Alright, so we're also doing some pulsed electromagnetic field therapy using their Pulse Center's Pro, NRG Pro, and this helps with tissue healing.
Bad knees can keep you from traveling, golfing, playing with your kids and grandkids. We are using the most up-to-date techniques to resolve your knee pain without surgery.
I feel so much better. It's like getting my life back.
All right, who do we have with us today?
My name is Ruth.
What kind of problem are you having?
I'm having problems with my left knee.
All right, and how long have you had left knee problems?
Probably 4 or 5 years.
4 or 5 years. And what would you say your typical pain range is for?
Anywhere from 3 to 7.
All right, and is there any things that you find that it's restricting you from doing?
Yes, I can't walk as much as I used to. Climbing stairs is very, very difficult.
Going up or down or both? Both.
When I go down backwards, so I don't have as much pain on the knee.
Okay.
And when I go up, sometimes I have to actually use my hands.
Four-wheel drive, as it were.
Yes.
That's what I call that.
So I really can't carry anything up the stairs unless I move it one step at a time.
Okay, so what I'm going to have you do today is I'm just going to have you bend down. I'm going to back up, and you're going to like bend your knees like you're going to squat to touch the floor, and you can stop anytime you feel like it's too much pain, and then we'll just ask you what type of pain you're getting then. Anytime you're ready.
That's about all it's going to bend.
All right, and then you can come back up. What kind of pain level do you have when you're down there?
It's probably 6 or 7.
Okay, 6 or 7. So I'm gonna look at the clock. We gotta see what time it is. I always like to show how effective Trigenics is. So it's 5 to 5. So now I'm gonna come back, and we're gonna do one Trigenics procedure that, based on looking at your muscle map, that's gonna give you the most benefit. And we'll see how it works. And we'll come back and we'll videotape you doing the same thing. And we'll go from there.
That's a happy juice.
There you go. Okay, so we did a Trigenics procedure for the knee.
Yes.
And actually we only did 2 different muscles. So we're going to see what happens. We're going to have you bend down again and just tell me how it feels.
I'm going further.
Yeah. And what pain
Before I
number
stop.
did you get to?
Maybe a 3.
So you decreased it by 3 as well.
Yeah, actually, this knee was better than this knee.
Exactly. Well, that's because we worked on that one. See? Now I'm going to go look over here. It literally took us,
5-10 minutes.
yeah, by the time we did everything. Yep. So that's not bad.
That's real good. Glasses on.
So how does that make you feel?
I feel a lot better. I was laughing.
You were. Good. So Bob, you told me that last Thursday,
Last Thursday.
you woke up.
Today's Tuesday. Yeah, last Thursday I woke up in the morning and the knee was stiff. And I just kind of ignored it and went on about my daily life. Friday, Saturday, Sunday was extremely painful and stiff. Could barely move it. Had to go up and down stairs one step at a time. It woke me up at night. I've been taking an awful lot of Advil ever since. And with time now it's gotten better, but it still hurts. I can't kneel down on it. It takes a lot of effort to get up and down.
Okay, so that's what we're going to do is we're just going to have you try and kneel down. If once it starts to hurt, don't go any further and then stand back up. So we're just going to observe, see how far this is. Anytime you're ready. Okay, and then back up. Okay, I can tell that's quite painful. All right, now we're going to do a trigenics knee procedure, and we're going to see what happens after we do that.
Okay.
We did a trigenics procedure on the front of the knee and the back of the knee, and we're going to see what happens when Bob bends down now, see how it feels. Go ahead.
Still stiff. But better.
Feels better. A little easier to get up. You can,
Halfway down it hurts.
and then it stops.
Yes.
Okay, because it looks like you got a little more power getting up.
Yeah.
It needs a little more work, but that's how much percent better?
It's a lot. I don't know, 50%?
And that's not bad for 5 minutes.
Mm-hmm.
Okay, good. All right, this is Bob. He's come back to just get a recheck on his knee, and you can tell us what you felt the day after your trigenics procedure, which was last Wednesday.
Yeah, today's Monday already. The day after the procedure, I had good range of motion and a lot less pain. I was still taking some Advil because of the pain and swelling that I had, but it was greatly reduced. Thursday evening, the day after the procedure, I had a Pilates class, and I noticed I had much more range of motion and flexibility that Thursday evening than I had in a long, long time before that. I can't even remember the last time I had that kind of flexibility. May have been the Advil or could have been this procedure.
All right, well, let's try the same thing you did the other day where you scoot down on, try and touch your hands to the floor by bending your knees.
Okay.
And then back up. That was like perfect.
No problem whatsoever.
Excellent. Well, thank you. All right, so can you just state your first name?
Roselia.
Roselia. And you've had knee pain for how long?
Years.
How
Many years. I would say it's been 10, 15 years that the right knee started on and off.
Okay, and what's the biggest impact it has on your life?
It's debilitating, completely debilitating.
So tell us about you and how far you can walk.
A few steps and then I need a chair. Because of the pain in the knees, if I stand in one position for a long time, the pain is excruciating and I can't move the legs
Okay.
because of the knee pain. And so I go from one chair to another within a few feet.
Okay, so what we're going to be doing is we're going to be doing a trigenics non-surgical operation on your knee to see if we can get some improved function for you and massively decreased pain. So to begin with, today what we want to do is just see how you can bend down with your knees like you're going to touch the floor, and just stop as soon as you feel bad.
Okay.
Anytime you're ready.
Okay, I'm ready.
So go ahead, I'll back up and we'll watch.
That's it.
That's it?
Yes.
Okay, so not very far at all.
No.
All right, so now, do you have a watch on, young man? Because I don't have a clock. Let's just look at it for a second.
2:42 it looks like about.
All right, good. Okay, it's after the procedure we did.
About 10 minutes.
Okay, and then we're gonna come back and we're gonna see what happens. So you're gonna do the same thing where you bend down and we'll just see how far you can go. I don't even know what's gonna happen, but let's check it out.
Okay. I put
Just
my
stop.
arms out,
Just stop
or-
when you hurt or when you don't
Okay.
want to go any further.
All right.
Go ahead.
Oh my God.
Any further? I love it. Is that cool or what?
Come on. That's wild. That's wild.
So how does that make you feel?
Unbelievable. Joyful.
Yeah, that's so cool. This is my favorite part. Thank you.
Amazing.
So it doesn't
Thank
take long,
you.
did it?
No.
All right, we're here for a testimonial on what our chronic knee pain program did for this young man. And who do I have in front of me?
This is Frank Limburner,
And Frank, how long have you had knee problems?
about a year and a half.
And can you describe what it felt like with your particular knee problem?
Mostly I would notice very severe pain after a round of golf, and it particularly was on the inside of my knees. Difficult in walking, but if I was at rest they were okay, but movement would cause severe pain, as I say, particularly on the inside of my knees.
And so at golf, you kind of got to walk a little bit, so that would make it a little more difficult
Yeah.
on your longer courses.
That's right, and I went to wearing braces, which helped.
What other activities that you wanted to participate in did you find that your knee problem was giving you problems with? Like travel or anything?
Travel was okay, but certainly going downstairs was very bad. Going up, not too bad, but very bad going downstairs. Obviously, I wasn't going jogging or anything like that, because that would have caused or did cause severe pain. So, not that I'm a big jogger, but
Right,
certainly I could not do that.
right. And then did you have any pain at all with driving?
Yes, and a lot of times thank goodness for speed control, because I could get my legs into a position where I could get relief. Also, particularly when I got out of the car after sitting there for an hour or two, very difficult to get moving. Once I got moving, it wasn't too bad.
Okay, so now what types of things did you try to do to get help with your knee prior to coming to see us?
Really didn't do much. I had x-rays, and the result of those x-rays indicated that I probably was a good candidate for knee replacement surgery. And I guess that at that point in time, that's when I came to see you.
All right. And so then you started our knee program, which comprised of several different things. We work on the whole nervous system from the spine down to the toes. And then occasionally we had to do some mechanical adjustments to the knee as well. And how did you find that experience? Was it comfortable, the whole process?
Absolutely no pain involved in the whole process. One of the things that besides the pain in my knees, I had very little sensation, let's say numbness in my lower legs, and through all the treatments, that feeling has come back, and maybe not 100%, but certainly come back a lot.
Right, so that's the beginning of peripheral neuropathy, that when you lose the sensations is with peripheral neuropathy, you start losing things and then you start gaining things like pain and balance problems and stuff. So it was good that we got to that on the early stages. And then so on a 1 to 10 scale at this point in time, what would you say as far as your pain is now?
My pain in my knees is probably 0. The only time that I will have pain is if at night sleeping, if I want to sleep on either side and put pressure on the inside of my knees in the matter of 15 minutes or to an hour, I will have pain and I have to go back to sleeping on my back. And that's the only way I try to sleep is on my back. And when I do that, I do not have any pain in my knees.
And the pain beforehand was, what would you say is worst?
Oh, well.
On that 1 to 10 scale?
Yeah, it would be probably an 8 or 9. Again, I said I wasn't in pain a lot
all
of the time.
Right.
Yeah.
But when you were, it was quite significant.
Yeah, right.
All right. So, and what would you say about someone who is considering doing some kind of additional thing to help their knee besides injections and surgery? Do you think this would be a viable option for them?
I think so. It certainly has worked for me. Anybody with my symptoms similar to me, I'm sure it would be very successful.
All right, so who do we have here with us?
I'm Melissa.
Melissa, you're having some left knee pain, right?
Correct.
Kneecap or?
Pain within the knee.
Within.
Yeah.
So what types of things have you been having problems with doing?
I cannot bend my knee very well, can't walk very well. I've been pretty restricted because of the knee and the pain.
How's the stairs, going up and down stairs?
Actually, I've been watching that pretty good.
That's
I'm
not
okay
bad.
with that.
What kind of bending aggravates you the most then?
Sitting, standing, from sitting position.
Oh, okay. So when you get up
Kneeling.
from, okay. So if we asked you to bend down like you're gonna
Squat.
touch the floor with your
Okay.
hands like squatting down, let's see what kind of activity this creates for you.
Ouch. That's about it.
So that's about it. Okay. So what? Come on back up. What pain level do you have there?
Probably about an 8 or a 9.
Ow.
Yeah.
All right. Well, let me just open this door here. I'm gonna pop over to this clock over here, and we're gonna see it says about almost 20 after 3. So what I'm gonna do is I'm going to do your very first trigenics procedure
Okay.
on a trial basis, right?
Right.
And if you get any results, whether you have pain improvement, range of motion increase, strength increase, then we know we can help you and then we can accept you for care.
Okay.
Okay? Okay, we just finished our trigenics procedure after explaining how to do all the 3 aspects of it. And we just had you walk down the hall. What did you say you noticed when you were walking?
That it was weird that I could actually use my foot when I walk.
So what normally happens?
And I kind of hold it and baby it and gimp.
Feels like it's more connected.
Yes.
That's what this
Yes.
does. All right, we'll just bend down. Let's see what happens.
Way better.
Okay, you had an 8
Wow.
before. What do you have now?
Maybe a 4? Way
50% improvement.
Yeah.
In
there was a difference.
10 minutes.
Yeah. Very. It's crazy.
So well, you know I can help you. That's the way it is.
Yay!